Hello, my name is Fatina Wazir. I'm FNP student at United States University, and today I am videoing an exam for the head, eye, ear, and nose and throat. Um, Today is Monday, December 23rd, 2024. So I'm just showing my room. The roof, the floor, and this is my equipment. I'm just going to adjust the video here. Hi, I'm going to sanitize my hand before I attend my patient. Hi, Miss Jean. My name is Fatina Wazir. I'm FNP student at United States University. Today we are videoing an exam for the head, eye, ear, and nose and throat. And we are going to load it to YouTube for educational purpose. Do you agree?
I do.
Okay. So how can I help you today?
I have this runny nose and sore throat.
Okay. How long it have been?
About 3 days.
Is it sharp pain, dull pain?
It's like more likely dull.
How bad is the pain?
About a 2.
Okay. Have you taken any treatment for it?
I didn't take medication, but I took sewer broth, honey hot liquid like tea. It is helping, but not lasting too long.
Anything aggravating it?
Not that I can recall.
Okay. Does it stay with you the whole day?
Pretty much most day, yeah.
Okay. So let's start with your examination. We'll start with the head examination, okay? So I'm inspecting your head. Your head is symmetry. I don't see any deformity, any trauma, any depression area, anything like that. Okay? I'm going to palpate your skull. There is no lumps. There is no depression. There is nothing abnormal I could palpate. Okay? I'm going to examine the texture of your hair and the distribution. So I'm just checking your head here to see if there is any area of hair loss or any sign of alopecia, which is nothing like that, and your hair is silky and straight. Okay. Okay. I'm looking at your face. Your face is symmetric. Your skin color is good. There is no sign of any jaundice or something like that. Okay. I'm looking at your eyebrow and your eyelashes. There is no lesions. There is no discharge. They are both symmetry. Also in your skull there was no lesions or any dry skin or any scabby skin. Okay. I'm looking at also your eyelid. Can you close your eyelid? Very good. So your eyelid closed properly, very well, and I don't see any extra like a fissure, like opening of the eye. Okay. And it is no erythema, no swelling, no deformities, and both they are symmetry. Okay, I'm going to palpate your lacrimal duct, which is no swelling, no redness, no excessive tear or something like that. Okay, so your sclera is the white part of your eyes, and I see it is white, which should be white. There is no sign of any jaundice. Your iris is the colored part of your eye, which is both are symmetric, and there is no deformity I can see in it. And also I'm looking at your cornea. It looks clear to me with no obvious opacity, I'm sorry, and there is no discharge from your eyes or something like that. Okay, now I'm going to look at your conjunctiva, both eye, look up. Okay, it's pink and moist. There is no discharge, there is no redness. They're looking normal. Okay. So now I'm going to examine your eye pupil no, before that, let's do come behind your back and look for from above to see if there is any sign of the exophthalmos, which is the bulging of the eyeball. Okay. But for now, I'm standing in front of you. I don't see any eyelid drooping, which is a ptosis, which is a good thing. Okay, let's examine that for the exophthalmos. Okay, there is nothing, which is a good thing. Okay, now I'm going to examine your pupil reaction
Okay.
to the direct light and consensual light, which is we are examining cranial nerve number 2 and 3.
Okay.
Okay? Cranial nerve number 2 is the optic, cranial nerve number 3 is the oculomotor. Okay? I'm going to shine the light, the pen light, in front of this eye, and I'm going to look at the pupil. It should be constricting. For the same eye we are shining the lights on. Okay, so I'm shining the light. It's constricting, which is the direct reaction, which is good. I'm going to shine the light in the same eye and look at the other eye pupil and see how it reacts, which is the consensual reaction, which is also constricting, which is pretty good. We're going to do the same with the other eye. Direct reaction, that's really good, it's constricting. Consensual reaction to light, looking to the other eye, with also is constricting, which is really good. By looking at your eye, I'm looking at the sclera and the iris. There is no sign of scarring or opacity. Okay. Okay. So there is let's examine also now, since we are doing the eye, the eye muscles.
Okay.
Extraocular muscles.
Okay.
Okay, so by doing that, we are examining nerve number 3, the oculomotor, cranial nerve number 4, tracholar, and number 6 is the abducens. Okay, so the superior muscle, the superior rectus muscle is central nerve cranial nerve number 3. The inferior oblique muscle is cranial nerve number 3. The lateral rectus muscle is cranial nerve number 6. The inferior rectus muscle is cranial nerve number 3 also. The superior oblique muscle is cranial nerve number 4.
Okay.
So if we draw an X, it's the cranial nerve number 3, the movement of the eye. Medial and down is cranial nerve number 4, and laterally is cranial nerve number 6. And let's examine that, okay? But I want you to look, we'll stand 2 feet away from you. I want you to look with both eyes to my finger.
Okay.
And follow my finger.
Okay.
Okay? We're going to go from the center here. Up. Yes, again to the center. Down. Again to the center. In front of you. Okay? It's like we're drawing a wide edge.
Okay.
We go to the middle here. Up. Center again. Down. Center again. And here. So by doing this, we check the eye muscles and the cranial nerves. There is no jerky movement. There is no sign of nystagmus, which is really good. Okay. So what we are also going to check your eye for by accommodation, conversions, and confrontation. Okay. We are examining the eye by accommodation. Okay, I'm using a pen, which I can use my pen light. Okay, I'm putting like 10 centimeters away from you, and I want you to look at the pen. Okay, and alternate the looking to far things.
Okay.
Look at the pen and to the far. Alternate. Okay, we are looking at the pupil reaction in this, and also the eye movement, which should constrict with the close, looking to the close item, and dilate looking to the far items. So we checked in both eyes, that was good. Now we're going to do the conversions. I'm going to put my finger 50 centimeters away from you, and I want you to focus on my finger. And I'm getting closer to you, so there is no also sign of we're looking for the jerky movement, and there's no sign of nystagmatism. We will do the exam by confrontation, which is examining nerve number 2, which is the optic nerve. By this, we have to examine each eye by itself, then we will examine both eye together. Okay, so I want you to close your left eye. You can close it by your hand or using the card. Left eye. I'm going to cover my right eye, okay? And I'm going to wiggle my hands from far. Look at me, look at my eyes, okay? And tell me when you see my hands.
See it, I see it, I see it, and I see it.
Okay, now we're going to switch the eyes.
Okay. I see it, I still see it, and I still see it.
Okay, now we're going to do the both eyes. Okay?
I see it.
Look directly to me.
Okay, I see them. I see them.
So we examine your peripheral vision, which is intact.
Okay.
That's really good. Okay. So now we're going to examine your vision.
Okay.
Okay. So I'm going to use the Snelling chart here, and according to this chart, we have to stay 6 feet away from you. So I'm going to extend my hand. You extend your hand, okay?
Okay.
And this is the distance for 6 feet. Okay. We're going to examine one eye after each other. You can take the card again.
Okay.
Okay. Can you close one of the eyes?
Okay.
Okay. Now, sorry, it's not showing my patient.
Okay.
I have to come closer just for the video purposes. Okay. For video purposes.
Okay. I think I will.
Okay. So, can you tell me can you read the clearest line?
LTFPH.
The small clearest one. Okay. Okay. Can we switch the eye now?
Sure.
Okay. Is it the same line? You see clearly, smallest line?
I think so, yeah.
Okay. Can you read the opposite way?
Sure. HPFTL.
Okay. Now we're going to do it with the both eyes.
Okay. LTFPH.
That's really good. You're not wearing any eyeglasses or any lenses like that.
No, I don't.
That's really good.
Okay.
So we finished the eye field exam and outside of the eye muscle.
Okay.
Now we're going to do the inner eye exam. Okay. By that, I'm going to switch the lights off. I'm going to use the ophthalmoscope.
Okay.
Okay. I'm going to turn it on and come from the side. First, we're going to look straight, which you're looking for the red reflex with both. When I could see it in both eyes. Then I'll come at 15 degrees here and shine the light and come closer to you. With the other hand, I'm going to support your head so I'll not come so close. With the this is your left, so I'm going to use my left hand and my left eye.
Okay.
Sorry, I need you to put the eye a little bit. Okay. And I'm going to examine the other eye now.
Okay. Maybe.
It's okay, it's coming.
Let me just go here.
Okay. Okay. So both eyes, I could see the optic, the retina. I could see the optic disc, which is a pinky, yellowish, oranges in color, and I could see the optic cup, and the ratio disc to cup is 3:1. The disc is crispy edges. I could see the blood vessels. The veins are bigger and darker than the arteries. The arteries are lighter and smaller. There's no sign of nicking. I could also see the fova and the macular.
Okay.
Okay, in both eyes, the same finding.
Okay.
Okay. By doing this, we are done with the eye.
Okay.
Okay. We'll go to the next step, which is your ear.
Okay.
Okay. So I'm looking here. Your ear is symmetric. Okay. I'm looking to the external ear for the helix, tagus. I'm pulling any pain.
No.
Mandibular mandibular bone. No.
No.
What about the other one? Any pain? when
No.
I'm pulling the helix or no, the pinna, no.
No.
So there is no erythema, no swelling, there is no discharge I could see from outside.
Okay.
Okay, so let's do the three testing for the hearing test,
Okay.
which is going to examine nerve number 8, cranial nerve number 8.
Okay.
Then we'll see the inner eye, the inner ear.
Okay.
Okay, so I'm going to come behind you.
Mm-hmm.
Okay. Okay. And I'm going to test this ear.
Okay.
So I'm going to close this ear by pressing on the targus and move it in a circle motion. I'm standing away like 2 feet from you.
Okay.
And I'm going to whisper for this ear 3 things, and you tell me what I'm saying.
Okay.
Apple, orange, banana.
Apple, orange, and banana.
Okay. We'll do that with the opposite ear.
Okay.
Sorry.
1, 2, 3.
That's really good.
Okay.
The second test is the whipper. I'm going to use the tuning fork, okay? And I'm going to place it in the crown on your forehead. Tell me where you hear or where you feel.
Both ears.
Okay, are both equally?
Mm-hmm.
That's good. That's negative test. We'll do the other one, which is the Rene test. I'll put it behind in the mandibular bone. Tell me when you stop hearing it.
Now.
Okay. I'll put it in front of your ear. Tell me when you stop hearing it.
Now.
Okay. We'll do the other ear. Tell me when you stop hearing it.
Now. Now.
That's great. It's also a negative test because the air conduction is double the bone conduction. While we're doing this test, I noticed the timing for the air conduction and bone conduction, and that is normal for you.
Okay.
Okay, so finishing the hearing test, we will see the inner ear.
Okay.
Okay, I'm going to use the otoscope. Before that, I'm going to do the tag test.
Okay.
But just let me fix the otoscope. Okay, the tag test, I'm going to pull in your pinna, backward, up and down. Any pain?
No.
Okay, the other ear, pulling out in back, like backward in your pinna, up and down.
No.
Okay, if there is any pain, this is a sign of infection.
Okay.
And now I'm going to examine your inner ear. Okay, so I'm looking at I'll pull your pinna up and backward. I'm supporting your head with my hand here. Okay, I'm seeing. Okay, I will discuss the finding with you after we finish the other ear.
Okay.
Okay, so both ears, the inner canal is clear, no erythema, no swelling, no drainage, no deformities. I could see the tympanic membrane is intact, pearly gray. I could see the cone of light in the right ear at 5 p.m. and in the left ear at 7 p.m. I could see the umbel in both ears. I could see the Paris tensor.
Okay.
Okay, and it looks normal to me. There is nothing wrong with it. Okay. Okay, so now we're going to examine your nose.
Okay.
Okay, so looking at your nostril, they're both symmetric. palpating for any deformity. There is no erythema, nothing I could see here, no deformities. Now I'm going to look at your mucosa.
Okay.
Let me change the otoscope. Sorry. Okay, I'm looking here at the mucosa and the turbinates. Okay, so our mucosa is pink and moist. Little bit erythema because you have that runny nose. I could see clear discharge. The turbinate is mildly edematous, but it's not so bad. There is no sign of any septal defect.
Okay.
Okay. For the nose, we're going to check the smell test and the airflow test.
Okay.
Okay, so you close one nostril. Okay, and the other one. Okay, that's really good. For the smell test, I want you to close your eyes. I'm going to place an object close to your nostril. Close one nostril, and tell me what you can smell.
Orange.
Okay, we're going to switch, closing still eyes, close the other nostril. Tell me what you can smell.
Coffee.
Okay, that's really good.
Okay.
Okay. We examined olfactory nerve, which is number 1 for the smell.
Okay.
Okay. From here, we're going to check the sinuses.
Okay.
Okay. So frontal sinus is here. Any pain, pressure,
No.
any tenderness? What about the maxillary sinuses?
Feels good.
Okay, that's really good. Now we're going to go to the throat. Okay. So the outer, we're inspecting first. Your lips is pink, no cracks, no lesions, nothing like that. Okay, I'm going to use my pen light to examine your inner mouth. Okay, open your mouth for me. So your gingiva is pinkish, no erythema. Your salivary gland, the parotid gland, and the Walton gland, they are in good with no edema, no lesions, no abnormalities, no extra salivation. The buccal mucosa pink and moist with no problem. Can I see your tongue? The papilla is a normal size. Okay, I'll see the back of your pharynx and your tonsils.
Okay.
Okay. Okay, I see your tonsils, mildly erythema because you have the running throat, and it's grade 2. There is no discharge. There is no severe edema or anything like that. It's just mild redness,
Okay.
and the uvula in the middle line.
Okay.
I forgot to see your teeth. Let
Okay.
me see your teeth. Are you wearing any dentures?
No.
Okay. No cavities, no sign of abscess, no deformities, which
Okay.
is a good thing.
Okay.
Now I want you to examine nerve number 12. I want you to stick your tongue out, okay? Right and left. Okay, when you put it straight now, there is no deviation in the tongue, which is good.
Okay.
I'm going to examine also your tongue strength,
Mhm.
okay?
Okay.
By pushing your tongue inside your cheek, and I'm going to push it with my hand.
Okay.
Okay,
Mhm.
that's really good. Okay, we said we're examining cranial nerve number 12.
Okay.
Right, okay. Now I want you to swallow. Okay, and I want you to open your mouth and say ah. Now I'm seeing your uvula is rising up, which is examining nerve number, cranial nerve number 9 and 10,
Okay.
which is really good. Okay, we done with the mouth.
Okay.
Okay, now we go down to the neck.
Okay.
Okay, so we're going to examine the muscle of the neck.
Mhm.
You just follow what I'm doing.
Mhm.
Okay, so we're doing flexion. Okay, hyperextension, lateral, lateral, rotation, and rotation. Okay? Any pain, any limitation when you're doing that?
No,
Okay, that's really good. Any headache?
no.
Okay. Now I'm going to examine the spinal accessory muscles by shrugging the shoulder as much as you can reach to your ear. Okay, that's really good. And we're going to check the trapeze muscles, which is fed by cranial nerve number 12. Okay, and that's I'll try to resist your fist turning from side to another. Okay, try to resist my hand, which is really good. Okay. By finishing with the muscle of the face and neck, we're going to examine the lymph nodes. Okay. So I'll start with the preocular, postocular, occipital, okay, anterior cervical, posterior cervical, mental, submandibular, sorry, and anterior cervical. They're all mobile, soft. There is no firm, there is no fixation, which is a normal thing. Okay, now I'm going to palpate your trachea. Okay, so I could see your trachea in the middle. You can move it to the side, in the midline, with no sign of deformity. Your neck is symmetry. I don't see any sign of any problem in there. And I'm going to check your thyroid gland. Okay, I'll ask you to take a sip of water and raise your head up when you swallow. Okay, I could see your thyroid going up and down, and the location of your thyroid between the TCT, the cricoid cartilage, right below the cricoid cartilage. Okay, I'm going to come behind you and palpate your thyroid. Okay, now can you swallow? Okay, I could feel it. It's soft. No swelling, no sign of hypertrophy, no nodes. That's really good. And by doing this, we finishing our exam for today. Thank you.